Hip pain. We're talking about hip pain, hip bursitis that causes lower back pain and also can travel down the outside of the legs, even the back of the legs, and can start pain in your knees. Welcome back. My name's Lucy Roberts from the Pain Free Tribe, and today we're going to look at how I treat somebody who has extreme hip pain, hip bursitis a lot of the time, and the outcome and how they feel at the end of it. Over the last 2 weeks, I've been treating a lovely lady. She's in her 60s. She plays golf normally regularly. She is very active. She goes for long walks with her husband. She's part of a group of ladies who meet up for walks, goes to coffee mornings, has lunches, and lives a really lovely active life. She's also joined a gym, which is one of these sort of gyms where you have a set of 8 machines and you just go in and you go around the 8 machines, and they're just trying to get some strength into the body. But last year in June, she had a terrible fall, and since then she's been really suffering. She's been to her GP. They've told her she has osteoarthritis, to rest and to take painkillers such as paracetamol to make her more comfortable. She went to the physio because she went back to the doctor. The physio gave her a few stretches to do. This didn't help. So she brings in the big guns, and that's me. One of my main skill sets is deep tissue massage therapy, and this is where I get in and I really strip back layers of muscle fibers and tension and try to relieve everything, get the circulation working, and get rid of inflammation. And by reducing the inflammation and stretching out the muscle fibers, getting into the knots and all the tension and relieving that, then things become a lot more comfortable and things start to heal properly. The other way I treat people is by looking at their diet and the kind of things that they may be taking on a regular basis, which is actually increasing the inflammation and dehydrating the muscle tissue and the fibers, the ligaments, which are making the whole situation worse. Deep tissue massage is something which addresses the deepest layers of the muscle tissue and releases the tension in the tendons and chronic muscle pain. It increases the blood flow and it stops muscle spasms. So after the first week of treating this lovely lady, it is quite intrusive and it is quite painful when we treat people with deep tissue massage, when we really get through and we get into the layers of the tension. It can be quite painful, and she was very sore for about 3 days. But when I go back a week later and I see her and she's got a big smile on her face and she goes, "Oh my God, for months I've been in such pain. And all of a sudden I can lie on my side in bed without pain. I am free, I can walk up the stairs," because previously she was struggling to even walk up her stairs. Her hip bursitis had literally crawled into her back. With the amount of tension that was going through her one hip, it meant that she was walking differently. She was protecting one side of her hip. She was walking upstairs or trying to walk upstairs in a very, very sort of awkward manner. This was putting a lot of strain on her lower back, and she was using her body differently. And over months and over time, this starts to affect everything. The top of her back is all tight. The middle of her back was tight. Everything is shifted out of balance. Her knees were starting to hurt, all because of this one fall and the fact that on her hip she had damaged some of the tissue. This had caused extreme inflammation, and there are little pockets in your hips and around the joint, and a hip bursitis is basically where the pockets of fluid, which are like cushions effectively protecting your hip, get very, very inflamed. All the muscle around those pockets of fluid start to get really, really tight. The body wants to protect your hip, so it closes down and starts to shut it down, and then the domino effect of other things happen along the way. So for me, I will treat somebody on my couch on their side where I really get into their hips. I'm really stripping back this tissue, and it can be quite painful to start with and uncomfortable, but afterwards the relief is unbelievable. We always ice after we've conducted deep tissue massage, because obviously I'm pushing a lot of blood flow through these muscle tissues, which means that in itself is inflaming everything. So once we've gone in there and we've pushed everything around and we've started to iron out all these knots and this tension, we then cool it all down, and the muscle fibers slowly then get themselves together and they start to knit back in the right order and properly. Now the other thing I do is I always sit down with people and I say, okay, can you talk me through how much water you're drinking during the day, what sort of foods you eat typically, how much sugar you're having, and I ask them to try and be as honest as they possibly can. And often I have people saying, well, you know, yeah, I like water and I do drink a couple of glasses of water, so yeah, I drink quite a lot of water. But it is amazing how much water people think they are getting in hydration to the actual reality. So I always ask people, look, do you like ginger? And if you like ginger, have some sliced up ginger in a mug, give it a bit of a bash with the back of a spoon just to release the juices. Slice up a couple of lemon slices, pop them in a mug, and just keep pouring hot water onto that all day long as your hot drink. This goes in, it hydrates the system. The ginger and the lemon hits the stomach, it reduces inflammation in the stomach, it will slowly work its way through to the gut, and everything over time will just be a little bit calmer and less acidic. The other thing is that I always sort of say to people, look, I know it's nice in this cold weather to have a cup of tea or a hot chocolate in the afternoon, a cup of tea with some biscuits, but please try and cut down on the sugar and acidic foods, because acidity in your system and dehydration is the #1 friend to inflammation. So by taking these foods and these liquids, saccharin, artificial sweeteners, pops, sugary drinks, they are all going to help towards inflaming what is already inflamed in your body and making it more painful. So if you're suffering from hip pain, chronic hip pain, hip bursitis, and it's traveling down your legs, the side of the leg, the IT band is getting really tight towards the knee and the knee's starting to hurt and it's got it up into the lower back, then I encourage you to look out for a good deep tissue therapist. Get some massage into those areas. If you can't find one or it's too expensive for you, start massaging yourself. Lie on your side and get a partner or a friend or family member to just gently but firmly knead that hip, to feel around that hip joint. You'll feel the knots and the tension. Get some coconut oil and really start to rub that area. And then after you've rubbed that area for a good 5 or 6 minutes, maybe 10 if necessary, get some frozen peas or an ice pack and pop it on top and just rest it. Also, I would encourage you to get the hot water, the lemon and the ginger down you during the day. Really hydrate those muscle tissues. By hydrating them, it's going to help reduce the inflammation. The ginger and the lemon is really going to help your stomach, and your immunity essentially is there to protect you and to heal things. So the more we can give your body what it needs, the better, the quicker, and the more comfortable you're going to be. With this lovely client of mine, I would typically go back for about 4 sessions on a weekly basis. You know, we sit down, we talk about what's happening, we adjust things. I always say, please don't do any cycling or abductor exercises, because that's going to irritate the muscle in the hip area. When you're putting pressure like that, you're just going to wind up the situation even worse. But gentle walks, keeping moving and keeping those massages and the stretching is really important. With this lovely lady, we're in the 3rd week this week and she's feeling a lot better. I cannot stress how good this treatment is. So please give it a go. This really will help you. If you found this information helpful, please subscribe to the channel. It helps us immensely. We're very new and we really would love YouTube to put us in front of a lot more people and to be able to help a lot more people. So the more people that watch our video and subscribes to us means that YouTube will do that for us. If you like the information as well, please consider subscribing to my Hot Lemon newsletter. It comes out every Sunday straight to your inbox. It's free of charge to sign up for. The link is below in this video. And also check out our website. Check out the other things we do. I often have free guides coming out to all sorts of things. So please take a look. Thank you so much for watching.